Hi, my name is Dr. Ross Hauser. Thank you for watching. We're actually in the Hauser Neck Center here in Fort Myers, Florida at Karim Medical, Florida. What we like to do sometimes is just talk to patients who have been through the prolotherapy procedures, and often what I like to highlight is cases that you may not think that they would respond to prolotherapy. So you've heard me a few times lecture on that neck instability, and problems in the neck can affect the vagus nerve. And the vagus nerve, as we all know, when the vagal tone is high or your vagus nerve innervation of the heart is high, the heart rate slows down. So if cervical instability or a change in the neck structure impedes or slows the vagus input to the heart, what happens is the heart rate speeds up. And Karim here has an amazing story of his journey. And you could see young guy, why would he all of a sudden have tachycardia or ectopic beats of the heart or signs and symptoms of an arrhythmia, and then also high blood pressure, right? Yeah. And then also his digestive tract wasn't working. So Karim, I'm going to sit over here and then you just tell us your story, and then what was it like getting prolotherapy, and then how are you now?
Yeah. So, it all started hard at March 2020 with one day I just woke up with tachycardia, high blood pressure, heart race. Like I used to sit down. My normal range of beat is between 61 and 76, and it used to be 98 all day, doing nothing, just staying, like probably sitting down, and my heart beats high. My blood pressure was high, was above 160 over 90 all the time.
And it normally was like 120 over 80?
Over 80.
Okay.
Yeah. And my digestion was bad.
What symptoms would you get with that?
It was diarrhea all the time. And every day I woke up in the morning, I get tachycardia. I went seeing 4 cardiologists and none of them could I figure out. Like I go, they do every test and they tell me everything looks good in your heart. And I went to see a neurologist, did all the epidural injections, facet injections, nothing helped. Even the pain didn't reduce the pain.
Yeah, what pain did you have?
I had the pain in my scapula. It was bad pain. And I went to see a spine specialist and spine surgeon. Now all of them tells me your neck is fine, you had nothing. But something inside me is telling me no, something is wrong, because I don't feel myself the old Karim back in the days. So I start looking until I found you on YouTube. All I did was type in straight neck, because one of the chiropractors I went to see, he told me you have a straight neck. So when I found you on YouTube, kind of your words made sense. When I looked at the first video that we have to strengthen the ligaments with prolotherapy, then do the curve correction. And then after the second video I hit, it was describing all my symptoms, like you telling me this is you. That's when I made the call down to Karim.
You're saying when you saw a video on the vagus nerve and how
yes.
if your vagus nerve input to your heart is inhibited or impeded, you're going to get tachycardia, it has to happen.
Yeah, that's exactly.
Okay.
So it was about the vagus nerve, and that's when I called and I came down, started here on November 2020.
Okay.
And
then what date is it now?
Today is 13th of July.
Okay, so what's happened over the course of the last 8 months, say?
I used to get Prolo every 4 weeks, and then last one it extended up to 8 weeks, and feeling just fine. My blood pressure improved, even lower than normal. My heart rates got improved, my digestion improved. My heart rate's if I'm sitting, it's in the normal range. It doesn't go above 76. And if I'm doing stuff, no, it is at 90. If I'm working out, if I'm running, so everything is normal. Blood pressure is normal. Digestion came back to normal. So feeling just awesome. Even the curve correction kind of helped me with my posture, because before I used to sit almost like this. And now, I mean, it feels really good.
Let me ask you this. How did you figure out, because you actually had to figure out that somehow your tachycardia or your high blood pressure was related to their neck? Like, how did you figure it out? What could you move your neck or do certain things, or why?
I couldn't move my neck, but one of the cardiologists, she mentioned, she was like, you might want to check your neck for these symptoms, because they kind of give you the same like heart attack symptoms. And that's when I was looking, and when I saw your videos, I figured out, yeah, it is related to the neck. But when I came here, I used, like, I couldn't, the range of motion of my neck wasn't that great. I couldn't turn left that easy.
Okay.
And sure, the instability was on the left when you did the checkup.
Yeah,
it was worse on the left.
Yeah, exactly.
Yeah.
When you had the tachycardia, often because the vagus tone is low, you get other symptoms. So some of the other symptoms would be like you get like anxiety, or your brain doesn't function quite right. So did you have any of those symptoms?
It was the anxiety attacks I used to get.
Yeah.
Yeah, that's
like you didn't have them before. They just kind of started. And you had told me that the thing really started in 2019, though it was really bad in 2020. But
yeah. In 2020, just one day I woke up, it was 2:30 at night, I woke up on tachycardia, like my heart beating faster.
Yeah.
And they took me to the emergency room for 2 days. And they did every test they can do, and they couldn't figure out what was the problem. They actually told me, you have nothing going on with your heart is fine.
So they thought you were just an anxious person, probably.
Yeah. So after that, I started looking for, when I found Prolotherapy, I just was like, because I was out of solutions. And I was like, this is the last guy I'm gonna go to and see if it's gonna help me out. And since then, it was a progress. You're not gonna get cured between a day and night. So it took, to get here, what I'm at now is 5 treatments. So you gotta have some patience.
How long did it take you? Like, how many treatments did you have to get before you start feeling better?
At the 4th treatment, start
feeling
better. Yeah.
The 4th, okay.
The 4th, yeah.
Yeah, so you did it. So you went a few months while we're treating you, and you still had symptoms, and then eventually there was enough healing where your vagal tone started to kick in, and then...
Yeah. And especially when I started the curve correction, it went from 5 minutes twice a day up to 15 minutes twice a day now. And I can do probably more, feeling no flare-ups, nothing. Before I couldn't do more than 5.
Yeah.
But now, Dr. Hutchison, he changed because he had me on the first ones, the neck weight and the head weight, and now only doing the head weight. And that head weight is just helping a lot.
Now, okay, so let's just talk about this. What do you think led you to have these problems? Like, what caused it?
It was looking down on data collector, sometimes computer at work.
Yeah.
Probably cell phones, I'm sure it caused part of it. So it's the lesson learned is never look down like this. No, gotta stay up.
Because you're saying really for years, like, wasn't it like for years you said like you're a data collector and you're on the computer, you're on your cell phone. So, the last 20 years, it took you...
It was actually the last 5 years.
Okay.
Basically. It's the last 5 years. And it
like hours and hours, like every day, like
every day,
hours and hours.
Yeah, hours and hours.
Okay.
Just looking down.
So in the future, are you going to have your computer set up better where you're not looking down?
Definitely. I even figured out a way to raise the data collector in front of me like this. Even the computer, raise it high, look up high.
Perfect.
Yeah.
Perfect.
Even some of the tricks you showed me to do while I'm driving, like do this and look high.
Yeah, exactly.
The curve too.
Yeah. And if we all did that, there's a lot of diseases we all wouldn't suffer from.
Yeah.
If we just maintained our curve alignment and... But I'm so happy for you. We're all so happy for you.